Yes, sir.
Okay.
Sir, is 3, 2, 1. Over to you, sir.
Morning, all, and welcome to Live Pharma Coalition, a global knowledge and networking platform for pharma professionals. As you know, every month, first Sunday, we go live and we invite industry experts across pharmaceutical industry to share their views on current challenges and best practices. And today's session, LPC 180, is a landmark episode. 180 episodes we have already completed due to continuous support and encouragement of you all. And today's episode 180 is going to focus on a very important aspect of healthcare sector, not only pharmaceuticals, but healthcare sector, and that is patient centricity. Everyone in healthcare, be it hospitals, be it healthcare professionals, be it pharmaceutical industry, be it marketeers, everyone is and insurance, medical insurance people, everyone who is involved in healthcare are talking about patient centricity. So with our experts, we will try to know about what is patient centricity and what we are doing in pharmaceuticals, what we are doing to be patient centric approach, and what is the AI element, right? Artificial intelligence element into patient centric approach. What is the current significance and what is the future aspect of patient centricity in healthcare sector? That is what we are going to share. And to discuss this topic, we have some of the eminent panelists. Mr. Shivraj Gowda, he is the founder, director, and CEO of Cuprion Biologics, having 20 years of experience in business development, sales and marketing, training. Not only that, his expertise is in analyzing market trends, leading from front. So, Mr. Shivraj, thank you very much. He is a regular member and core team member of LPC. Thank you very much, Mr. Shivraj, for accepting our invite. A brief about your opinion about topic, a brief overview.
Yeah, first of all, thank you, H1G and a whole LPC team, and doing this amazing and fantastic, structure, which was not available in Indian pharma, and you people are doing an amazing job. I'm so happy to be a part of this, and every time you all come with a so interesting topic, which is so critical for the industry and for everyone. And today's topic is much more interesting. Which we all are talking about, patient centric, right? So I think that's something really amazing. And yeah, I think as you rightly said, everyone is working towards that, with be it doctor, be it pharmaceutical companies, BI, the health tech companies, everyone is working towards patient centric, and that is evolving in a very large way. I think that's the future is going to be, and specifically for the Indian pharma industry. So it's nowhere the patients are no longer as a passive recipients of healthcare, which was driven by the traditional way. They are active participants these days, and who can seek personalized care and expect their voices to be heard. That's something which is interesting. And by adopting the patient-centric approach, pharmaceutical companies can build the trust, which is the most critical, right? It is not just about selling a drug. Can build the trust, the increased patient satisfaction, and also the ultimately the drive better health outcomes, which is the most critical. I believe this is the way it should be going to be, and I think that will really have the great partnership between the who are the stakeholders in the entire the pharma and patients and doctors and everyone who are the stakeholders. That's how the going to be. That's where I believe, and I think everyone is working. I'm sure everyone is working towards on that the vision, specifically the Indian domestic market, which is much more critical, because we have a wide range of people are present, and the affordability. There are many challenges we have in India. I think that's going to be the key driving path for all of us in next couple of years, which is the future.
Thank you. Thank you very much for the overview of your topic. And with Mr. Shivraj Gowda, we have Ms. Vaishali Waghela, She is the marketing manager, having more than decades experience in pharmaceutical industry, and she has worked in companies like Universal Nutri-Sciences, USB, and Acumentis and Hetero Drugs. She is known for bringing digital element in marketing and design thinking. She has done course from on design thinking from University of Virginia and also negotiation strategies from University of Michigan. So, ma'am, thank you very much for accepting our invite and being a part of LPC today. Also, you are a regular speaker. You are always there whenever we need a speaker. You are always there. It is so nice of you. And what is your overview? You told me during the pre-work that AI element is very, very important aspect of patient centricity. A brief overview, ma'am.
So yeah, good morning everyone and good morning lovely audience. It's a Sunday and we taking a little time of yours. So, Yashwanji, thank you for your introduction as well. So having a decade of experience, what I've understood so far and whatever the experiences and the learnings which I've got. So we being in a pharma, we have a lot of traditional marketing as a prescription marketing going, then, the consumer marketing going. So we are always, having a thought of a regular traditional marketing thoughts. And we have never integrated our thoughts into what is new and how can we actually kind of a bridge a gap with mixture of a traditional marketing and integrating a digital marketing into it. So maybe that's the one of the reason actually, we are today here to discuss about the empowering healthcare and unleashing the potential of a patient-centric AI strategies. So maybe with this, I would just like to, give you a brief idea that if we embark onto this journey, where actually one thing is about the technology, how it, compassionately match with the patient centric and how we can merge this seamlessly with this power of a AI, which is artificial intelligence. And we say that, right now we have a AI and a lot of things are algorithm driven and a lot of things like right now we get it ready made. I mean, all the data, but how do we kind of validate if it is, useful to us or maybe if it is valuable to us or not? And have we, done any kind of a thing? Because see, Google is also there and we used to be using this Google and then now AI came into picture. There's a lot of difference, but looking into a difference, we do not know the authenticity of the data. So one thing is about that. But looking into a pros and cons, but still we as a, we as a pharma leaders and we as a pharma people, we need to be integrating this device, and AI will help us in designing a lot of strategies efficiently and implementing it effectively. Because right now, if we do not do this revolutionizing approach, we will not take this revolutionizing approach, then I don't think so, we with the flow right now, because traditional marketing has gone. And if we see the sales also, if we see a marketing also, if we just follow this kind of approaches, then I think so we are a little behind from the world. And world is trying to adopt this AI strategies, and I think so we also have to be, utilizing it. And I think in the coming session of ours and coming discussions, I will throw a little light on how can we utilize this patient centric approach in integrating with this AI. So maybe that's
Yes.
what it is.
Definitely. Thank you very much. Thank you very much. We look forward to learn from you. And we also have Mr. Roshan Raj. He's a senior brand manager in Sepla, having approximately decades of experience in the pharmaceutical industry. He has worked in Aristo Pharmaceutical, Torrent Pharmaceutical, Anglomed, and Cachet Pharmaceuticals before joining Cipla allergic rhinitis team. He is representing the respiratory segment of Cipla, where the Cipla is known for respiratory segment and doing a lot of work in patient-centric campaigns in allergic rhinitis segment. So, Mr. Roshan Raj, thank you very much for joining. He is a marketing. He has done MBA marketing from Nursing Institute of Management Studies. So thank you very much, Mr. Roshan, for accepting our invite and being a part of this panel discussion. A brief overview about the topic, Roshan.
First and foremost, thanks a lot, sir, for giving me this opportunity to speak on one of the topics which is a buzzword in the industry. And when I listen this particular word, patient centricity, so what essentially it means, it is why it is needed, because it lays the basic foundation of high quality healthcare. It's not only increases the engagement amongst the patient, doctors, maybe the caregivers, family members, but also helps to educate the patient about the health condition and the possible treatment option. But why? Because if you see in current scenario, digitalism and consumerism have given the power of choice to a larger population. Second thing, which is external competition and market saturation, have forced the companies to deliver experience and content designed to satisfy the consumer. Because if they don't, someone else will. Now, one more statement which I usually think, and that is true, that 50% of patients do not take their medication as prescribed in the long term. It is happening with antibiotics. It is happening with all even with diabetic medicines. And why it is happening? The causes of this non-compliance are myriad and include patient factor. For example, forgetfulness, cost, the biggest reason, inability to obtain medication. Second, at physicians or HCP's level, poor doctor-patient relationship. You know the ratio in India. What exactly is the ratio? It is well known. For every 11, 12 patients, there is just one doctor. That too in urban areas. In rural, the situation is very poor. Communication issues, because they are not having time to discuss their concern with the doctors. Ideally, they're getting somewhere close to 1 minute. In some cases, 30 minutes, especially with top QLs I'm talking of. And third, of course, medication factors like adverse events, compliance regimens and everything. So I think this is where and this is why I think patient centricity becomes very important and it should be taken very seriously. Thank you.
Wonderful, wonderful. Thank you very much for sharing your overview, Mr. Roshan Raj. Two important aspects you told about is adherence is a big question mark. In chronic medication, people don't adhere to the therapy and healthcare options are not available in rural area, right? So whatever healthcare professionals and healthcare companies offering to the patient should be centric to the patient's need according to their need, and then only the outcome will be better. Two, three important elements Mr. Shivaraj Gowda told in the introduction part. He told about trust. It will build trust. It will build satisfaction, and also outcome of the healthcare will be better. There are three elements he told about significant. So I would like to go to Mr. Shivraj again to further take the discussion. What is the current scenario, Mr. Shivraj? What is the current scenario? What is the significance of patient centricity in current way? Your opinion, Mr. Shivraj.
Yeah, so where I was touching about the trust factor between the pharmaceutical companies and the patient, I think that's something which is probably need to be taken seriously now, and because the kind of population what we have in India, and I mean we are number one in the world, and as Roshan was mentioning, the adherence of the prescription is one of the biggest challenge in India, and the doctor versus the patient ratio, which is completely a mismatch what we have. So we have sitting with the biggest challenges, and then yet we need to really drive down. Probably, I think this is the time. I think the patient-centric approach is the most critical. And of course, there is a lot of Indian population is getting into a middle class and earning potential. Everything is increasing. And this is the right time for us to catch the rest of the world. And probably where I look at it's the awareness at that ground level, the patient's awareness, probably what he was mentioning about the why it is so important to continue the prescriptions consistently, continuation of the prescriptions, be it at the same time awareness of the diseases, awareness of chronic illnesses. It may be there are specific illnesses which need to be educated. Currently, probably the education level where I still believe it's a huge gap. Okay, and that need to be taken care. Probably let's look at one of the illnesses like piles and fistula. I'm just giving an example. How much awareness we have, and how much till what extent we wait. Okay, to go to a doctor or to share even in the own families. I think that's where the social stigma which we all are having it. And when they land up in a doctor, probably they're already in a chronic stage. right? Or it may be eventually getting into many things, and it may be the confidence level, it may be a productivity level. Okay, if you look at the GDP, I mean, I'm saying there are many things are contributing just because of that awareness is missing. So I would see like pharmaceutical companies, anyway, we see that the posters are inside the doctors' clinics and everything, but probably this needs to go beyond. Because I think we're currently in the digital era, and as Vaishali was mentioning on the AI side, so probably in the digital side, how can we educate the people more awareness? I think a lot of companies are coming forward, but again, we have a lot of compliance challenges. We have being in pharma industry, probably how to synchronize that compliance versus the awareness, so that patients get so much of knowledge and they know where to go, where to land up. Otherwise, again, because of the we have a ratio is so much of gap, they may end up with the unfortunately with the somewhere else, and they may not get the right treatment. I think that's also one of the biggest challenges we have. So the very critically, I think pharmaceutical industries, which is one of the biggest, we are the mostly the what we call it as now in formulation or producing the drugs, we are almost one of the heavyweights in the world. I think if probably we can, all of us can, from the pharma industry perspective, and probably the government initiation come together, I think this is the time to really reach out to the public and talk about it. I think that will really enhance the awareness, enhance the trust factor even for the pharmaceutical companies, and enhance even the government setup. And also we can bring the compliance together rather than it's more looking into a business model, and then everybody is fingering at that person or that company because there is a compliance issue, and then the whole thing is getting dropped down. That's what we see last 2-3 years. I think that's something which we all need to look at it as an awareness. Okay, I'm not just saying about piles or fistula. There are many illnesses. Okay, I think probably the CNS market in India, which is one of the lowest, probably, but I think probably everyone in a lifetime we go through a challenging situation, and probably we need to consult a psychiatrist. But that's awareness is missing. Probably here the social stigma again coming here, and probably we are getting into a chronic stage, and where we are getting into it. So again, if you look at it, if again we looked at a patient-centric approach as a strategy from the pharmaceutical companies, from the government authorities, I think that's kind of a synchronization which is really, really needed when digital healthcare or digitalization is on the highest peak. Probably we need to utilize that to the maximum extent. I think that's where I come from. And also, if you look at it, another patient-centric approach, which is, I just don't name the company at this point of time. We all know the one company which is started in 1995, and they went into a patient-centric approach, just focusing on the cost center, reducing the price of the drug. I think they are probably the early movers. Aggressive went on, and they're connected with even the name of the company with the people, that is the patients and the doctors. And we all know the story of the company, which is today where they have reached, probably their top 5 in India. Nobody was thought about that. I think that tells, if even now, if you look at it next 20-30 years, if we look at a patient-centric approach as a strategy, even for the pharma business perspective, that company can withstand or can grow very well. At the same time, they're doing a great things to the patients out there. I think that's where I see, because it has to happen, because obviously it cannot just go with this awareness or just just like that. But I think this is the building proposition needs to happen, so that that can be taken into the next level as a cost factor. I think now if you look at it, even in India, now we have the pricing structure, the compliance is so high. Every drug is monitored with there are a lot of essential drugs are monitored in the, whereas essential drugs are priced in a specific price where we are capped. And what it says, because that's how the market is changing, and now more and more essential drugs are coming under drug price control. I think that tells a story that the market is actually, we are in the patient-centric approach, but it's not just about the cost, but it's beyond many things. It be it quality, be it everything. I think recently I saw one of the companies talking about how they're sourcing the raw material. Okay, and they're looking really banging in the market. I think again that tells what, because they're reaching out to the public to awareness about the quality of the product which they're selling it. I think that's really happening. But I think probably on the digitalization side, I think I would see the more videos can created and give the awareness to the general public. about, and they can reach out to the specific specialty doctors with whom can really go back and check it in the mobile applications, where they can really get those doctors, and they can reach out rather than delaying so much, and when they're getting into a challenging situation. I think a lot of coordination required, a lot of collaboration is required from every angle, so that on a pharmaceutical industry perspective, it is most critical, where we can build a trust and satisfaction. That's where I see Yashwanji. I think you're muted, Yashwanji. Yashwanji, you're muted.
You're on a mute mode.
Oh, great. So some of the very important element about patient centricity, which Shivraj has highlighted and put into the desk, I would like to just quickly recap on the things. One very important aspect he told about partnership, government and private partnership, to make the people educated and aware about the disease profile, prophylaxis, prevention measures, and do's and don'ts. So people will be more aware about the disease. This is very important. Here I want to add, apart from government and pharmaceuticals, I think corporate hospitals like Apollo hospitals, they also can add value to that, because they are also involved with them. Their also business is through patient only. And medical insurance companies, right? Another important point you told about is some of the disease where stigma is there, like you told that piles or some gynecological disease. So ladies and ladies, they don't want to talk about the disease, and some of the psychiatric disease, right? So people, although they know there is a depression patient, epilepsy patient in my family, but they don't want to reveal that. That is the biggest problem. So that they are not coming to mainstream of the healthcare. There we need to address those things, how we can bring those patients to the mainstream of healthcare, then only they will get proper treatment. Another important thing you told about is the collaboration, creating some patient education videos, right? Lot of social media is going on, of making people aware. If you see diabetes and have heart problems, lot of videos are coming, lot of videos are coming for diabetes and heart problem, but no videos are there on this type of disease, where people don't want to reveal. So we need to do something on that, right? And then you told about one company which launched the company in 1995, but they captured the entire market by only one patient-centric approach, giving patient affordable medicine. I also heard about the company. I have been following the company. Just 1% profit margin they kept. First 5 years, their profit margin was 1%. That is how they made the price of the medicines low, so that in a rural area they capture the market, and they are one of the top 5 company. That is how we can, that is the impact of patient centricity. Now I would like to go to Vaishali ma'am to learn more about element AI, artificial intelligence aspect of patient centric approach. Ma'am, your opinion.
Yeah, thank you. So I think, I will relate with the Mr. Shivraj, like what he mentioned about the patient centricity. And in today's time, how do we perceive this patient centricity in our pharma industry? So maybe right now it's very much important that patient-centric approach should be there, because as a marketer, what I understand, like if we get into our marketing strategic, strategy building, or maybe a budget meeting, we always think about our brand, our product, and then we relate with the market and what growth we want to give it to our brands. But we never think as a marketer that, like, okay, if we want to be having a patient-centric approach, then what all elements needs to be taken into consideration. We always go for a traditional method of something to be given it to a doctor, and doctor in return it to be given it to a patient. And that's how we try to connect a touch point, and that's how we try to, build our strategies. So here, when I look at it from the perspective, when he said, the Mr. Shivraj mentioned about the government also have to be, having a collaborations with the pharma, as well as, the corporate hospitals and into consideration. This all are our stakeholders, and this collaborations is needed basically to actually, the activate and, make this evolving landscape of the healthcare to have some kind of a fusion of a patient-centric principle and the AI-driven strategies. Because without this collaboration, this will nothing, hold true, I think so. And that's where I feel like this transformative force that can revolutionize this way of approach. And here I would like to, throw a little light about this understanding of a patient-centric care. Like if I want to take a little bit of an example of a different specialities to be handling, like if it is the oncology, if it is a cardiology, if it is orthopedician, derma. So little bit of a chronic specialities and the acute specialities. So chronic specialities actually requires a lot of a patient-centric approach, because that goes for a longer period of a time. And that's where, when we say that the videos which we see, it's more of a cardiac and not others are there in the market, and we don't see a lot of awareness about the disease and the therapies. So that's where we lack of this knowledge, and maybe our patients are also not aware. So that's the one point wherein it comes around one topic, which is, we need to aware about our patient centric and where in which specialty we are, and what kind of a target audience we are having, and how do we kind of bridge the gap. And the other thing is, the importance of the doctor patient relationship. We are actually, we always go about like our target audience is orthopedician, suppose I'm taking an example, and then we will just talk about like orthopedician related disease, osteoarthritis, osteoporosis, but we do not know how the doctor and patient relationships are. That's where also one of the important challenges right now, to have a trust on a patient's outcome, because the impact of communication and trust needs to be there, so that the some outcome comes. And that's where our strategy also have the some kind of implementations and the successful rates, if we can kind of see it. So here I would say, we need some AI, which is to be AI thing which will have a personalized treatment plans. Like they'll have to analyze the patient's data, then the medical history, then the genetic informations, and how do we kind of create this tailored made personalized treatment for individual needs and preferences. So that's where I see that this AI will help us in making a individualized treatment plans for the patients. Like oncology, if I take an example of a breast cancer, then breast cancer has 4 stages of the cancer, and if it is a metastatic stage of a cancer, then how this kind of a genomes and how this genetic informations to be captured, medical history, and that's how pharma can help us in providing a best medicine to this targeted therapy and to this personalized treatment plan. So that's the AI will help us out in generating a benefit to a patient's doctor, and the pharma can come into a picture. Another thing is we talk about the chronic medicines and the adherence to a medicines, and that's where one more thing, like the patients are not adhering to a one type of a medicine. If it is given telma, then telma is taken for a long time, but later on some point in time, obviously this telma patient will not take telma, or maybe doctor will suggest some other drugs. So that's how it is happening all across. So how do we kind of integrate this AI powered medication adherence, so that this implementation of medication adherence programs comes into picture, and that can actually have a personalized reminders. And then maybe it will have educational resources, supports, how these patients can uniquely have the health profile and their treatment journey. If they'll have a ready-made treatment journey along with them, suppose like I have started my medications from this 3rd of December, and the next 3rd of December, how am I actually evaluating my patient journey? What all medications I am taking? So I think this tool, the AI tool, with the help of a pharma, if it reaches to the patient, then maybe it will be a really useful tool. So that's how I feel, this one of the important thing. Other than that, we do a lot of case studies. I think, Roshan will also agree with me. In our studies, we always talk about a lot of case studies, lot of LBLs, lot of patients awareness activity. But I don't think so. With that, once we talk about what outcomes are we getting, so we are always a question mark, right? So and I think one more thing is not about a case studies, but real time evidence data as well. And when we try to do this and we say that okay, yeah, we have got, but I must say, this is my experience in terms of a strategy, the real time evidence gives a really good result, that I have seen it. So how do we kind of even integrate this real-time evidence into this virtual health assistant? So I feel like, we do not have to gather a data manually in terms of, using all the files and generating a data and then analyzing. Here also the AI can help us in assessing, our all the data and gathering all the data with the help of the virtual health assistants. With the patients, it will give a personalized manuals, the real-time responses, then what all medication informations, and how do we kind of deliver this customized health tips also to our patients. So, what I'm trying to say is nothing but just only real-time evidence gathering a data for our kind of a product. But in turn, I think we can use and utilize this data with the help of AI to generate a more touch point and have this doctor-patient relationship ongoing. Because we always tend to lose our doctor patient relationship beyond a one point in time. One strategy is rolled out, it will be run through a 3 months, 6 months, and then we actually jump into some other strategy. That's what we actually do. We never actually trying to build something which it runs through. So another thing in terms of the patient education, because that is very, very important, which I mentioned also. The currently
Okay, I think there is a disconnection from Vaishali's side. Maybe network disconnection. We'll come back to Vaishali once he sees live. So 2, 3 important points he told about virtual health assistance and creating some more touch point in the patient journey. Not only that, how AI can help in detection, diagnosis, adherence to the treatment. That is very, very important. Right. So let us go to Roshan Raj now to understand what they are doing to create a patient awareness or patient-centric approach. As you know, Cipla, a company who is one of the first company to think about patient centricity when no one was talking. I remember I joined Cipla in 1994. That time there was a slogan, none shall be denied. I like that none shall be denied. And due to this slogan, they told their view is no patient should be denied medication just because of it is not available in India, just because they cannot afford the medicine. And that is the journey of patient centricity in Sepla, when no one was taking. Just for your information of the viewers, in South Africa, the cost of AIDS medicine was $30 a month, $30 a day. And most cases of AIDS were there in Africa. And people were not able to afford those $30 a day medicine. Cipla came and provided the same medicine $1 a day. That is the power of Cipla. And millions of patients in Africa were saved because of this Cipla approach of providing without any profit. They provided the medicine to government of Africa, and millions patients were saved because of this approach. Most of the multinational companies, they were opposing this supply approach because their profit was not coming because of this approach. But you see the patient centricity of Cipla's mind, none shall be denied. That is what is the important. So let us hear from Roshan Raj what they are doing for patient centric approach. Yes.
Hope I'm audible.
Yes.
First and foremost, I would like to start with a line that I'm really very fortunate to have an organization like this where we can just not talk, but walk our talk about patient centricity, what they feel, how they feel, why they feel. And if you see, we are talking of a strategy, patient centric strategy. But in current scenario with our organization, it is not about strategy, but it's about patient-centric culture. Means everywhere we have to think of patient, because in length we have discussed so many things. Thanks to Shivraj, thanks to Vaishali, that they have almost taken all the important aspects which needs to be considered when we talk of patient centricity. So rather, I would like to maybe give an example. Right? Okay, what exactly is the patient-centric culture? Because we have discussed patient journey, we have discussed data, we have discussed AI, how exactly it can help, and thanks to both of them, because they have really captured all the aspects which is really needed for a patient-centric strategy, approach, or at last when it becomes a culture. So let me use an example to substantiate our last 30 minutes discussion. And maybe I'll take example of allergy in that case. And then I would request you to assume India as a nation, the population of 1.4 billion, which translates into 20% of global population, having great diversity with respect to, let's say, environment, rates, type of infection, socio-economic strata. Within population, there are various differences a lot, like population, diet, culture, language, religious belief, literacy, aerobiology, and climate. Now, considering all these aspects, if you see allergy, it's a result of complex interaction between, genetic, environment, and multiple lifestyle factors. So if a country like India offers an excellent platforms to investigate with respect to patient centric approach or strategy, or maybe a culture and a natural course of allergic disease. But irony is that if you look at most published literature regarding to allergic conditions or atopy, which comes from high income English speaking countries, which may not directly applicable to low middle income countries such as India, due to a fundamental difference in genetic, environment. We have 6 seasons, 6 ritu hai hamare yahan, lifestyle factors. So there is an emerging evidence regarding the prevalence of allergic rhinitis in India as compared to other countries. So we need not to look at West that this is what they are thinking, this is what they have. Just for example, case studies, which Ms. Vaishali has told. Case studies are not enough. LBLs are not enough. We have, if we really want to build a patient-centric culture, it has to be all across, not in marketing, but in studies also. And I think that is where we are working. That is where we are shaping the therapy. If you look at our therapy shaping initiatives, we are really helping doctors in diagnosis of allergic rhinitis. We are using that patient data for knowledge dissemination, that this is the current status of allergic prevalence with respect to age, with respect to gender, with respect to geography. More so, we are also helping them with what sort of medication should be used. Just for example, if I would like to use, ARIA guidelines says that INCS should be used as the first line, but by practice, it is otherwise. Because if you look at, almost only top QLs are going by this this particular statement or maybe algorithm. But most of the doctors, what happens to a patient when he suffers allergy? Ideally, what he does is he ideally ignores it for the first maybe 1 week's time, because he considered it to be a trivial. Now, when it aggravates, he usually goes to a medical shop and he buys anything which comes to his mind. We all know what is cetirizine. We all know what is levocetirizine. We all know what is montelukast. We take this. Then we go to a doctor. And once again, this cycle is repeated there as well. Why? Because somewhere everyone is considering allergic rhinitis or maybe allergy as a trivial disease. And by the time 6 months or 3 months passes, it aggravates. And it needs a treatment close to 2 to 3 months. But see the situation, what is happening. Are we really taking a medication for, let's say, 1 month? No. Still, it is considered to be a SOS. So this is the challenge, and this is where we are working. Not only educating patient, but we are also gathering real-time data with respect to AR. Then we are using it for knowledge dissemination by publishing and using it. So this is how we are progressing ahead. And we believe in developing a culture, patient-centric culture. And this is how we are proceeding forward. Thank you.
Wonderful, wonderful, Mr. Roshan Raj. So 2-3 important aspect as Vaishali ma'am has reconnected. We'll go to ma'am again. Before that, 2-3 important aspect what Mr. Roshan Raj has put upon of Cipla's view on patient centricity. Walk the talk. That is the motto, as he is told. Not only that, patient centric culture. How a company pharmaceutical company, healthcare company can think about a culture of patient centricity where every decision is taken keeping the patient in the core, whether this decision will be benefiting my patient or not. Another important aspect, he told ki all the studies today we have about the disease profile, about the medication is done. Clinical trials are done in Western countries and European countries. They are not relevant to India like countries. And he gave one example of allergies, right? So we have six seasons in India. So allergy is very, very different in India as compared to Western countries. So their studies may not be relevant for our context. And that is why there comes studies based on Indian population, real-time data, evidence-based data, which will be more appropriate for our people and which will be relevant for our diagnosis and management, right? Another thing he told about is a platform, to create a platform where investigation can be done, studies can be done, and delivery can be done of the medicines, emerging trends, and more important is partnership. Thank you very much, Mr. Roshan Raj, for sharing this input. Now, Vaishali madam was, when she was disconnected, she was sharing about 2, 3 important aspects, and that are AI powered diagnosis, AI powered health assistant who can ensure the adherence to the therapy, which is very, very important for patient centricity, right? Detection, diagnosis, adherence, that can be done. Reminding the about the medicine, not changing the brands very frequently if the AI power health assistance is there. These are the things we can do. Yes, ma'am. Over to you. You want to share some important points
Yes.
more?
Surely. Thank you. So, to start with, where we were talking about, a bit about patient-centric care, then about the AI, how can it be integrated, and maybe how can we have I would say the marriage of a patient centricity and the AI, basically.
Right.
I would say that I will quote it in that way, because see, a lot of things being pharma is doing from last so many years. It's not that we have not touched upon, but we have touched upon, but we need to be touching upon with the some other digital tools available as well. So how do we kind of tailor made it, or maybe tailor made treatment plans with the health data, or maybe real life success stories which will improve patient outcomes. So that's the one thing. And another thing is, which I would like to talk about, is the future of a healthcare. I mean, if we say right now, like predictive analysis or a preventive care, then do we have anything which is concrete with us, like if this is the patient and this patient's the life history is looks like to be this, and the patient's journey going ahead would be this. So how do we kind of predict this? Like if suppose a cancer patient, then cancer patient goes to a metastatic stage and the last final stage, so how do we predict it? So I feel like here also this AI tool will help us in predicting this potential health issues in terms of this proactive interventions. And also, how do we kind of shift from our approach from the reactive to a proactive and preventive measures healthcare models? Like we always often often the patients undergoes a heart attack or something, and then we become reactive to this action and reactive to such kind of a situation. Instead of this, if we kind of become a preventive healthcare, preventive system, if we kind of place it with the help of this AI, then patient will also be in control. Like how do we kind of predict it? Then that's how I feel this AI will help us. Or another thing is also about the patient's education, that I was talking about, that we modulate a lot of patients educations in today's time. We see a lot of QR codes going out in the market, a lot of patients informations patients are actually approached to. But I think it's not a tailor made. I think every patient doesn't have to go to the same QR code, doesn't have to actually utilize the same information which is available on the internet, or maybe a pharma people are giving. In this, actually, patient education and the chronic therapies or chronic specialties can do a well better thing in terms of this, because they have a set pattern of if I say cardiac patients, onco patients, diabetic patients, they have a set pattern of flows which are already being run through. Like after one stage, another stage comes into picture. So that's where this tailor-made approach can be used in terms of personalizing their treatment explanations, their lifestyle recommendations, their patient's characteristics, and how do we kind of build this patient educations with the help of a AI. Another thing which I want to highlight here is about the telemedicine. So telemedicine has a lot of scope in today's time, like in terms of how do we kind of scheduleize our intelligent way of scheduling our personalized health assessments, or maybe automated follow-ups will pop up. It will come on, it will automatically come, and ensuring this patient centricity with the efficient virtual healthcare system enabling. So this can also come into picture, like if we kind of utilize such kind of a telemedicine, because PSP is a lot of people are using patient support system, the patient support program, which is being always used by a lot of MNCs in today's time. But in this, if this can be also collaborated, sorry, am I?
Yes,
Yeah.
yes, you're audible.
Yeah,
Audible.
yeah. I think so. I have a literally bad internet,
No, it's the internet.
but
It happens sometimes.
yeah. So with this, I feel, if this PSP program along with this AI enhanced telemedicine can be integrated, that can be also one approach which we can always think about with the help of a AI. Another one thing I would throw a light onto, which is a gamifications for a health. I mean, how do we kind of motivate a patient with a chronic therapy? What it happens is a lot of times people are actually get bored, or maybe a daily routine they follow, like I have to pop up this diabetic pill, or maybe I have to pop up this BP medicines. They lose their interest, and some period time they'll forget taking medicines. They'll no, and sometimes it happens that they don't want to take it only. So that's where I feel this, how this health apps have to be managed in a way that this can be engaging as well as it is a personalized, in terms of giving some kind of a reward based onto a individual patient progress, or preferences on that their preferences basis. So I feel this gamification for a health, like some pharma companies, if they adopt this kind of a strategy as a tool, then I think this doctor patient relationship and what we're talking about, the patient centricity, can be really well managed and evolved. Another data security and patient trust. I feel we have a lot of data with all the pharma companies. They, one or the another way, lot of data we have. But I think so if it is formulated in a manner wherein patient concerns and their data security with this AI driven solutions, we can have a sensitive, we do have a sensitive informations, and that can be formulated into a lot of different strategies, and that's how maybe patient will get a benefit out of this. So with this, I would, I would just give you a little bit of a recap, which I think, we stand at the intersection of this patient-centric care and the AI. So we need to be like, paradigm in shifting this approach and in this healthcare dynamic. So let us embrace this transformative era with ensuring that we harness as our power of AI, and maybe we remain our commitment to putting a patients at the heart of our healthcare endeavor. So thank you.
Thank you, ma'am. Very relevant, a very important aspect of patient centricity you highlighted. So before going to the future of patient centricity to Mr. Shivraj Goda, I will just quickly revisit 2, 3 important elements. You told a broad approach of integrating patient centricity with AI. That is what is the broad topic you are providing or putting into offer. And here 2, 3 elements are the detection and adherence to the therapy, patient education, which should be a tailor-made approach to the patient, which is very, very important. Another important aspect you told about telemedicine and telehealth, which are being evolved. If you remember, this telemedicine approach, this entire concept was evolved keeping patient in mind. A lot of rural area patients could not afford to go to the city centers and big cities for their treatment, and then only the evolvement of telemedicine happens, so that the at least consultant can reach them virtually and help them in disease management. So this is very, very important to integrate telehealth and telemedicine in patient-centric approach. Another important thing you told about is the gamification, right? So that patient is interested in adhering. I remember I was zonal manager in Wokat in Aurangabad, and there is a doctor called Dr. P.G. Moghe. He's a leading diabetologist having a lot of patients. So what he used to do, once in a year, he will take diabetic picnic. All the diabetic patient will go on picnic, and lot of games they will play. They will enjoy life, and we used to sponsor that, being the pharma company. So I like that approach of patient centricity or gamification. People should enjoy the process, the journey of their management. And he used to give one gulab jamun that was allowed on that day. Whole year they will restrict the diet, but that day is free. He told ki you can enjoy anything you want. Ice cream and gulab jamun will be served by Wokhad. No problem, you have. But after that, again, strict diet plan. So something like that we can definitely do, companies can do to keep patient interest, momentum on adherence. Biggest problem is the adherence. So that can be done, right? So, and that data security also you told. So now I would like to go to Shivraj sir again. Sir, as a closing remarks, what do you think? How do you see the future of patient centricity? Your opinion, how we can collaborate and work out? Yes, sir. Unmute, sir. Unmute.
Yeah. So I think probably it's a coincidence, or we say in life, nothing is an accident. When I got a message from you people about this being a panelist, I would like to share something very interesting. We are working from last couple of months on the digital healthcare transformation. So we are launching our product very soon. And that's where I think, and the topic is patient centric, to be honest. That's what we're working on right now, where we have a mission where we want to reach out more than 1 lakh doctors in the next 3 years. Where we want to digitalize the doctors, and thereby we want to reach out the patients. I think when I was just remembering now how it is like related now. So that's something what we are trying to do here is probably we want to really build the structure, or probably the branding for doctors, probably building in a couple of things around. And also a lot of being Bangalore, we are I know we are more of a tech savvy, so we are trying to build some technology there. And then there is a relationship between the patients and the doctors, and also the patients can reach out to the specific doctors and specialities and what they're going to do. And that's something which we are trying to do. And next year something which we're trying. I think something like this, like I'm sure the many organizations or pharmaceutical companies are working on this. That will help. I think, as again I'm saying, as Roshan was mentioning, right, there is a huge gap between the patient versus doctor ratio we have in India. And I think, and anyway, the gap is really bridging faster. But I think because of our population, I think it will take much more time. Probably that focus can happen. That's really the need of the hour right now. I feel it's an emergency kind of a stuff when we have a digital isn't really on the peak, and India is one of the dominant player in the digital space. A lot of the startups are coming, the technology are coming, medtech companies are coming, and health tech companies are coming. And so I think if we can really bridge the doctors and the patient, that's a first step I would see, because where we are missing a lot of the critical time and structure. I think that's something which is need to be done. I think probably most of the bigger giants in pharma, they can come in and really work on and I mean I'm sure they're working on it, but there will probably we can increased focus, and then bringing the collaboration with the government. I think that's something amazing. I just want to highlight one more thing, how collaboration really works magic. I think we all know how the Covaxin got produced in India with indigenously. Yeah, ICMR, the government body, and the Bharat Biotech came together and really produced something miracle. And not only supporting the India, but also we supported many other countries. We exported. I think that shows the kind of a collaboration. Because why? Because there was a patient centric. There was a scarcity. We never knew how much vaccine we will get it, whether we'll get an import or not. There are many challenges, but we never kept quiet. And the government took an initiative. ICMR gone very aggressive, and found out the partner again, Indian company Bharat Biotech, and we saw the collaboration. That's a real magic we have created at that particular critical time. I think that is what we needed. That kind of an emergency we need to bring forth right now, because as we mentioned in the beginning, there's a huge gap in the first place itself, the awareness and the rural population, and it's a very big gap. I think we can bring an emergency there, and we can really work together as a team, not as an individual, as a company or as a government body or as a doctor's body, or rather than that we can work together and bring the compliance. The biggest challenge here is data leakage, the compliance issue, all this. I think if we can really, as Vaishali was mentioning, even the EI has the challenges because of the compliance in India is the biggest challenge. So how can we work together to synchronize all this and bring that synergy to take it forward? And also, I know recently I was in Singapore Tech Summit, and I met a gentleman, and he's developing a company, and again from India, where they're working on a pediatric care. Very nice. I was very interested to know, because that's something which is the very critical. The malnutrition, happens in that stage, because as a mother, she goes maybe a traditional approach, or may not, or she may be following for various reasons or the various challenges. She drives the way she wants to drive, but that may not be right, and the kid may be suffering. And now these people, this tech company from India, want to work on that, as in using the AI and reaching out to those population, specifically the gynec and the child, which is the future for us. I think I was really thrilled, again from India, and they're showcasing in a very big scale now. So like this, I think that's something very interesting. And also probably we should also look at it, the geriatric care, right? I could see now a lot of the geriatric care setups are coming in India. And I think again there, because there also we need a caretakers, because in the typical geriatric cases where the caretakers are becomes the most critical. So how can we engage the caretakers in this process, where we can really take care of the geriatric patients using the patient-centric approach, again the pharma companies, because I believe there is a huge partnership possible here, because most of the geriatric patients are consuming so many medications, right, already. And if pharma companies can come in here in a more of a caretaker driven education structure, that will be really probably that kind of a loyalty those people will carry, the caretakers. There's one more caretakers probably in the mental retardedness cases, because again the caretakers are the biggest stakeholders, right? So again, if we can bring that awareness structure for the caretakers in a very bigger way, then probably in a home, as Yashwanji was mentioning, we can identify probably that person may not be able to get it, but if the caretaker understands because this person needs it, or even after diagnosis, the continuing the treatment is also very critical, and where the caretaker comes into a critical picture. So that's need to be really needed as an engagement process. So that's what I could see here. I think the collaboration is a key, I would see in India, specifically the massive country like India, and we have demonstrated in Covaxin when we are producing. I'm also happy because we are one of the vendors for Bharat Biotech at that point of time, and that really an amazing story, right? I think that's what is needed in going for next 20-30 years. And I always tell people, I met one person in Singapore, and in a tech, he is becoming an entrepreneur there in last 3 years now. I said, why you are moving to Singapore now, right? Because next 20 years belongs to India. Global stage, I was telling that. So I think that's probably how we are growing as a tech center of the world. We can bring the health tech as a much more bigger space, and bring the partnership of government, the doctors, and the pharmaceutical companies. I think we're in a that's need that is the need of the hour is needed right now. Yeah. So that's what I would see, Yashwanji.
Thank you very much. Thank you very much. Wonderful insights. 2, 3 important aspects you added value based before you had about in the beginning. You told about 3 things I like most is the importance. It will build trust. It will build satisfaction, and patient outcome will be better based on that. And integration and partnership is the utmost need. And Paxa made one important Singapore event you shared, how they are thinking about patient centricity and pediatric care providing right nutrition to the patient. So by approaching on pediatrician and gynecology, that is a wonderful thing of patient centricity. Not only that, you told about geriatric care. Not only that, geriatric care and also palliative care. Most of the critically ill patients like cancer patient, terminally ill cancer patient, terminally ill HIV patient, where the doctor has told ki nothing can, medication can do anything, only thing is we can do care. There comes the approach of patient centricity. How we can give them a peaceful satisfaction life for 3 months, 4 months, 1 year, like that. There comes the role of palliative care center and geriatric center. Thank you very much for sharing, Mr. Shivraj. Now let me go to Vaishali ma'am for closing remarks. Ma'am, we have already exceeded the time. So brief closing remarks about your take-home message to the viewers. Before that, a lot of viewers have appreciated our sessions. Let me name them. Nasiruddin Chisti, good morning, sir. Wonderful topic and wonderful relevance. Dinesh Babu, thank you very much. Satvant Kaur Manku, ma'am, is watching. Great going, Team LPC. Thank you, ma'am. Arasan Armugam, Cipla created more awareness on asthma disease and become leader. Thyronorm also become leader on worked on disease awareness and skin disease. Yes, many companies are doing on the diabetes, thyroid care, and bone management also. Prabhakar Jha is watching as well. Sandeep Day sir is watching and also has appreciated our. Thank you very much, sir. Apart from this, Anil Fernandez sir, ICS Verma sir, Arpan Kumar Paul. Thank you very much, everyone, for watching. Kushagra Mathur, Bhavik Patil. Thank you very much for appreciating our venture in the show and watching live. Thank you very much, everyone, for your encouragement comment. Now I go to Vaishali ma'am for the closing remark. Yes, ma'am. Unmute. Yes.
Yeah. So I think, I have summarized it all in all go, but I would say, what would be the take home message for today's session would be like, how do we kind of combine our patient centric principles with our AI technologies, and how do we actually kind of connect our stakeholders basically, like healthcare providers, our pharma, corporate hospitals, government, and how do we kind of create a one healthcare ecosystem that only will not only address the unique needs of our patients, but also, how do we kind of we will leverage this data driven insights, and the amalgamation of both will generate, a continuous improvised version and the personalized version of our care delivery process. That's what I think, this is the take home message for today's session and a discussion, and integration of our ultimately needs of a patients, their personalized treatment plan, their adherence system. How do we kind of, generate reward systems so that this patient should stick on to the medications, and then how they'll be having a predictive future for them. Then how do we kind of generate our real evidence data with the help of this? So this all will create a one efficient and more effective and, a kind of a patient satisfying healthcare experience, as well as for the individuals and as well as for the
Okay.
pharma.
I think network is a little challenge today with the Vaishali ma'am. No problem. But she has given a
So
very good
that's
aspect
how
of.
I look into it. Right, Rijik, and am I audible?
Yes, yes, audible, ma'am. In between the voice is cracking, but you're audible.
Yashwanji, am I audible? Yeah.
Yes, yes.
So that's the only message which I would want to give, that, how do we kind of actually kind of amalgamate our an exploration of our future with the technology and compensating the conversion and the transformation into a reality for this empowering this innovations of artificial intelligence. So thank you so much.
Thank you, ma'am. Thank you very much. Wonderful aspect you brought into patient centricity. Thank you very much. Now I'll go to Roshan Raj for the closing remarks. Roshan, thank you very much. First time you have come to our LPC platform. How was your feedback about this platform and your closing remarks to the audience?
So my experience was really great, sir. And of course, I gained a lot of insights, maybe from all of you,
Yeah.
from you, from Mr. Shivraj, from Ms. Vaishali. And I'm very fortunate to have attended this session. And for closing remarks, I believe you want to listen on future of patient centricity, I guess.
Yes.
To be very
Yes.
honest, sir, I'm literally blank to speak on the future of patient centricity. Because what comes to my mind is very simple and small steps that we need to take now so that we can build better future with respect to patients. Because when you look at patients and when you come from a place, because I come from a place called Bihar, I am fortunate to be in Patna because it's a capital. But when you go to rural areas of Bihar, Odisha, Madhya Pradesh, just imagine a patient standing in AIMS Delhi. Just imagine a family of that patient standing in AIMS Delhi. How difficult it is for that particular person to endure, to get a care out there. It's a very big institute. Everything is there, but you see how everyone you look at there is like a frightened calf. They do not know where to go, how to go, what needs to be done, huge line and all of so what comes to mind is a simple steps that we should take now to build a better future. Once again, if anything that comes to my mind is an example, of course. And why example? Because I believe with something actionable happening there. So I remember just three friends and a healthcare startup who is making doctors available in rural India just for rupees 1. Ankash Tandon along with his two friends. So there is a app, there is a card, and they have made it possible in just 1 rupee a day. It costs around 365 rupees for a year, and you can just consult a doctor entire year. So to improve primary healthcare services in rural areas, three people launched DigiCure is the name of that particular application, which provides teleconsultation at rupees 1. He claims that he has catered close to 20,000 patients in rural areas of MP, Odisha, and Bihar. Because if you look at in rural areas, what do we consider? Because people blame their destiny and maybe God's will if anyone comes to a disease. And if that is the case, then why it is happening with us only? Why it is not happening with West? Because this is not God wanted for us. It's a gap, basically. And there we need to partner with, because team is something which has been discussed with Mr. Sivraj, that it is not one person to act. It is not one person to organization. It is not one body to act. We need to act as a team. Because see, this small startup has they connect unprivileged rural residents with healthcare specialists via video consultation through subscription based card, cost 1 rupee. They also offer digital prescription, lab test services, if needed, referrals, and partner to hospital for secondary care. Because if you look at the condition, a majority of disease load in India because of insufficient, primary healthcare services. I don't want to talk of. There is a shortfall of doctors as well, which we have already discussed earlier. Maybe community level centers in rural areas, and doctors do not want to go to villages. This is the irony. So this forces rural residents to leave their daily wages job, pack their bags, and run to the hospital in cities, or endure the suffering back home. And what it costs? It costs fortune, time, and of course productivity. So once again, really, I'm blank on the future of patient centricity. But yes, one thing which I can assure is that I'll continue to take my small steps so that I can contribute to the society at my individual capacity. And that's it, sir. Thank you.
Thank you. Thank you very much. A wonderful insight, Roshan Raj. You have told about some practical aspects which are required in today's situation without worrying about the future, so that we can reach to the patient at the last mile provide them the right healthcare solutions without having the complexity of big institute like AIMS, and which is the required, which is the need of the day, which is the need of the time, right? So to closing remarks, thank you very much everyone for accepting our invite and being a part of LPC discussion today. Wonderful discussion, lot of aspect of patient centricity we have covered. Everyone is talking about patient centricity across the healthcare system, not only pharmaceuticals, but also corporate hospitals, but also government enterprises, but also insurance, medical insurance people. So it is not time for talking. We need to walk the talk. We need to do something concrete to reach to the patient and provide him the holistic approach to the healthcare system. That is the need, as we touched upon some of the important aspect of collaboration, partnership, and also integrating AI element and technology to reach to the patient. So thank you very much, everyone. Once again, thank you all the viewers for watching and appreciating our concept and adding value to that. We look forward to you all in the next episode, again with another topic and another set of speakers. Thank you very much, everyone. All the best and have a nice Sunday. Thank you. Thank you very much.
Thank you. Thank you, everyone. Goodbye.
Thank you. Goodbye.
Thank you so much, sir, so for me ending this.
Yes, thank you. Please close that. Thank you very much, Yogita.